We're going to talk about the 3 things we absolutely need to survive as a human in today's world, and that is food, water, and dopamine. We need dopamine because it's the chemical responsible for motivation. It's this thing that's responsible for us going and making a friend, having a mother have a bond with a baby. It's the thing that motivates us when we do good to do better. When somebody pats you on the back and says, "Good job," and you go to do something more significant, that's because your dopamine has gotten pinged and it's just something pushing you, this invisible chemical that's pushing you along the path. On a normal day, we even know how much dopamine we're supposed to have. So on Monday morning, when I wake up and I have to get up and I go to work, I live in the range of about 50 nanograms per deciliter of dopamine. That sits in the central part of my brain, and that's required for me to get out of bed and go get that first cup of coffee. Now, what about the worst day? The really bad day? The day you call your office and you fake vomit in the phone and you decide not to go in. You're like, "I just can't make it." That's about 40 nanograms per deciliter. So not much lower, but low enough to where you just want to sit around in your pajamas all day and do nothing. What about the best day ever? The day where all at once you win the lottery, you have 2% body fat, and you're living on the beach. All of those things happen at the exact same time. We even know that one. That's 100 nanograms per deciliter. Our brain is meant to go all the way to there. It's not really meant to go above. And we can look at things like your favorite food, which is like 94 nanograms per deciliter. And sex, 92 nanograms per deciliter. Bummer, right? Couldn't have predicted that. Maybe they need to redo that research. But at the same time, we know that we're supposed to live within this relative normal state between 40 on a horrible day and 100 on our best day. So what happens when we add a chemical into the brain like methamphetamine? This chemical is really important because it pushes us way past that 100 nanograms per deciliter. In fact, it actually pushes up to 1,100 nanograms per deciliter, more than 10 times the amount of dopamine that our brain should be making. And then, if we look at things like marijuana or alcohol or heroin, these are things that push it up into the high hundreds. This is not what we're supposed to be doing. As we look at this, we have the normal that we're supposed to be. We have this large jump for something like methamphetamine. And then we have these other drugs that drive that dopamine up. And when that happens, it starts to take over that part of the brain. And no longer does going to your child's birthday make you happy. It's not happening. The things that normally make us feel happy start to pale in comparison. This is because the brain is built to survive. In fact, we know that this is a survival issue for the brain, mainly because dopamine is what drives us to procreate, to get food, to get water, like we talked about. And we know so much about addiction and all of these things that are going on in that part of the brain that we actually know the parts of the brain responsible for this motivation and this dopamine release. It's places like the anterior cingulate gyrus, the lateral bed nuclei of the amygdala, the nucleus accumbens, the ventral tegmental area, the periaqueductal gray. We know this. And by the end of all of these videos on this site, you're going to know exactly what each of those parts do. But for now, you should understand that this area of the brain called the limbic system, which includes, but it's not limited to, the ventral tegmental area and the nucleus accumbens, are responsible for reward. And the fact that we can look on an MRI and see these parts of the brain working, and we can see them working in a patient who is not on any drugs, and those that have been on illicit substances for a long time, and see major differences in how these structures work, is really important because it allows us to start to understand things like behavior. Let's say we found this person, we get them into treatment, and we remove that drug. Now we have people whose dopamine goes all the way down to as low as 10 nanograms per deciliter. And on their best day ever, it's only 20 nanograms per deciliter. These are numbers that matter, and we're going to keep hammering on these because when you have 10 nanograms per deciliter, you can't get out of bed. You can't get up to put your clothes on and go to a job interview or to even take care of yourself or your family. When we lack dopamine, the body craves it. And when you crave dopamine, you get into survival mode. And that leads to primal action. And that primal action is a lot of times the behavior that we see. How can they take grandma's jewelry? How can they steal a credit card? How can they pawn something that they owned? Their brain is telling them that they are not going to survive if they don't get dopamine. And the thing that gives them the dopamine that they need, as far as they know, is that drug of choice. Behavior is so much about how we define addiction that we even use it as the diagnosis. The DSM-5, the Diagnostic and Statistic Manual version 5, which is what all psychiatrists use to help define mental health disorders, defines addiction not based on some lab test, not based on a urine drug screen, but very much bases it on the behaviors of a person. And we break it into really 4 major areas, 4 pillars, and there are 11 criteria in those 4 pillars. When people are looting stores when there's a famine, or when people are doing what they can to survive for their children or to not die, we accept those things. What about an addiction? We took patients who hadn't had their drug of choice, and in these cases, for these studies, it was alcohol and opioids. And so when we took those patients and we put them in a functional MRI and we asked them a couple of basic questions. Tell me about the first time that you used your drug and the last time that you used your drug. That's all we really asked. That craving of just thinking about the drug lit that brain up. And it lit it up no matter if you were 30 days, 60 days, 90 days, or 1 year. It was almost exactly the same. That craving signal in the brain did not decrease until 2 years. And what we found was the relative size of that craving was not a baseball or a basketball. It was a baseball field. So the craving for dopamine and that drug of choice so far outstretches the desire to not die from dehydration and starvation that it starts to make me understand why these behaviors happen so consistently among patients who have had the disease of addiction.